Hi, I'm Spenser Gabin, Associate Marriage and Family Therapist here at Bold Health. Today I'm going to talk a little bit about exposure and response prevention, or ERP, for OCD, Obsessive Compulsive Disorder. So, what is exposure and response prevention? Exposure and response prevention is really the gold standard treatment for treating OCD. So, I'm going to explain a little bit about how it works and why it works. So first, let's actually just start with the definition of OCD. So OCD consists of two main components. First, we have obsessions, which are often sort of what if questions. What if I've got something contaminated on my hands? What if I hit someone while I'm driving? What if I don't really love my wife? Those kinds of what if obsessional questions. And then we have compulsions, which are things that one does to try to deal with that anxiety from those what if questions. So that could be hand washing, it could be seeking reassurance, it could be driving my car back around to where I was to check to see if I hit someone. Really anything that we do to try to get relief from those obsessions. So, OCD functions by really creating an association between a situation and anxiety, and then also the compulsion that we do and the relief that we get from that compulsion. Those are really the two components that undergird OCD. Exposure and response prevention is a treatment that is designed to actually break those two associations and then really break down OCD and give people relief. First, the exposure piece. When we have an obsession, there's a sense that I need to avoid whatever triggers that obsession. I need to get out of that situation to avoid the anxiety that it brings up. So, for example, hit and run OCD is a very common theme. So let's use that one. So the obsession there is, what if I hit someone while driving? What if I accidentally hit someone and didn't notice? What if I make some kind of mistake on the road and have to live with the consequences of that? Okay, all those kinds of what if questions. So there's an association that driving is this really scary thing, and often people will then try to avoid it, to avoid having to deal with those obsessions. They'll just stay off the road or have someone else drive, or they'll do tons of checking, things like that. And so the first way we're going to break that down with exposure and response prevention is actually just to expose someone to driving. And so exposure is really this broad principle in psychology that when we expose ourselves to a stimulus that may seem threatening, but actually isn't all that threatening, and we stick with it, anxiety does fade over time. So you might be familiar with just exposure therapy for something like a spider phobia. So for this, we have this fear of spiders, and maybe when we see a spider, we run away. One way of treating this is to actually stick with that spider for a longer period of time. So if we are used to seeing one for 5 seconds and running out of the room, we learn that, okay, great, that's how I'm going to deal with that anxiety, is to run out of the room when that spider comes in. Now, with exposure, we try to stay with that spider for 10 minutes. Okay, we did 10 minutes, maybe a half an hour. Half an hour, okay, can we do an hour? Over time, exposure, this is a broad principle in psychology, tends to reduce our anxiety. So we learned that, okay, wait, I actually stayed with this spider for half an hour. Hey, nothing actually that bad happened. I didn't die, the spider didn't bite me, and I'm able to tolerate that anxiety. So that exposure piece, just to bring it back to exposure and response prevention, is also important with something like hit and run OCD. Okay, so the exposure piece is to get on the road. The second component, though, response prevention, is crucially important to actually break down OCD. So with that, we're trying to break that association between that compulsion, that response, and the relief that we get from it. So let's take, again, hit and run OCD. We might get relief from seeking reassurance from our partner that we didn't hit someone. We might call police stations. We might actually replay where we drove in our mind's eye, over and over again to, wait, did I really hit someone? What happened there? We want to interrupt all of that and really stop doing those things. because we want to learn to get relief from just sitting with the anxiety, from just tolerating it, rather than the relief from the compulsion. Now, at first, this is going to lead to a spike in anxiety if someone's used to getting the relief from the compulsions. But over time, we get what we call that habituation from the anxiety coming down. Now, the truth is we don't always get habituation with ERP, exposure and response prevention treatment. The most critical point is we actually learn that we can handle that situation. We can manage that anxiety. We can manage that uncertainty without needing to do the compulsion. We can feel okay not being 100% sure that we didn't hit someone on the road. Over time, that's going to really break down the foundation of OCD, and that's going to empower people to feel more free in their lives, more comfortable taking, again, the small amount of risk that we all take when we get on the road. Anyway, I hope this was helpful. Please reach out if you're interested in doing exposure and response prevention therapy, something I really enjoy doing with people because it helps bring a sense of confidence and freedom back into people's lives.